Good day, listeners, and welcome to DDM Health News Updates. Under our program, Your Health, Your Wealth. Today, we'll bring you a critical update from the World Health Organization, WHO, which has announced a groundbreaking expansion of malaria vaccination programs. By the end of 2025, up to 25 countries are expected to integrate malaria vaccines into their national childhood immunization schedules, a move projected to save tens of thousands of young lives each year. However, this remarkable progress comes against a backdrop of alarming financial constraints that threatens to undermine decades of advancements in global disease control. WHO Director General Dr. Tedros Adhanom Ghebreyesus sounded the alarm earlier this week during an online media briefing, cautioning that recent cuts in US funding for global health initiatives could have dire consequences worldwide. For more than 2 decades, the United States has played a pivotal role in the fight against malaria, contributing by an estimated 2.2 billion infections and the savings of approximately 12.7 million lives. However, with the recent reduction in funding, particularly through key agencies such as USAID and the US Centers for Disease Control and Prevention, CDC, critical health programs are now facing significant disruptions. According to Dr. Ghebreyesus, stock-outs and delayed deliveries of malaria diagnostics, medications, insecticide-treated bed nets are already being reported in several affected regions. If this disruption persists, WHO estimates that an additional 50 million malaria cases and 107,000 deaths could occur this year alone, jeopardizing more than 15 years of hard-fought progress. Beyond malaria, the ripple effects of these funding cuts are being felt across multiple health fronts. The suspension of financial support to the President's Emergency Plan for AIDS Relief, PEPFAR, has already led to service shutdowns in over 50 countries, disrupting again access to life-saving HIV treatment, testing, and prevention. WHO warns that at least 8 nations are experiencing severe shortages of antiretroviral therapy, with some potentially exhausting their medical supplies in the coming months. The implications are staggering. Over 10 million new HIV infections and 3 million HIV-related deaths could occur if urgent action is not taken. Tuberculosis programs, too, are facing mounting challenges. Across 27 countries in Africa and Asia, shortages of healthcare workers, diagnostic tools, and failing data systems threaten to reverse progress to tuberculosis control. Already, 9 nations have reported supply chain disruptions in essential TB medications, leaving vulnerable populations at risk. Meanwhile, as measles outbreaks surge globally, the WHO's Global Measles and Rubella Network, founded entirely by the US, stands on the brink of collapse. In 2024 alone, 57 large-scale measles outbreaks have been recorded, underscoring the urgency of sustaining immunization efforts. Adding to the complexity, these funding shortfalls are also hampering polio eradication efforts, disease surveillance initiatives, emergency response to humanitarian crises. An estimated 24 million people living in fragile health settings may soon lose access to essential medical care, further exacerbating global health disparities. Dr. Ghebreyesus has made an urgent appeal to the international community calling for increased donor commitments and urging nations that have historically relied on US funding to enhance their domestic health investments. The stake could not be higher. As the world stands at this pivotal moment, the question remains, will global leaders step up to bridge the funding gap? Or will years of progress in disease prevention be undone? The coming months will be crucial in shaping the future of global health. Next, the Jigawa State government and the United Nations Children's Fund, UNICEF, have formalized a strategic collaboration aimed at advancing child and women's welfare in the state. At a high-level signing ceremony held at the government house in Dusty, Governor Malam Umar Namadi and Mr. Rahama Rehud Mohammed Farah, chief of UNICEF's Kano Field Office, ratified a multi-year work plan spanning 2025 to 2027. This comprehensive framework seeks to drive transformative progress in critical sectors such as education, healthcare, water and sanitation, economic empowerment. Governor Namadi reaffirmed his administration's unwavering commitment to ensure adequate funding for the full realization of the plan's objectives. Furthermore, he highlighted the ambitious scope of the initiative, underscoring the substantial resources required to achieve meaningful and lasting change. The governor also acknowledged UNICEF's enduring partnership with Jigawa State, dating back to its establishment in 1991, and lauded the organization's steadfast support in mobilizing resources for developmental programs. In his remarks, UNICEF's chief of the Kano Fields Office, Mr. Farah, commended Jigawa State's innovative approach to development, particularly through pioneering initiatives such as Masaki and Jakadan Lafia in the nutrition and health sectors. Well, while recognizing the state's commitment, he also called for increased domestic investment to sustain progress and mitigate reliance on the dwindling global donor funding. Development stakeholders view these agreements as a landmark achievement with the potential to significantly enhance educational opportunities, healthcare delivery, and economic growth in Jigawa State. Well, friends and well-wishers, this will be all on our program, Your Health, Your Wealth. Stay with us for more updates as this situation unfolds. I remain your host, Nenyo Michaelin Ezindi. Definitely, we will continue keeping you informed on these stories that matter. But don't forget to click on the like button, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media, for more updates. Bye for now.